5:30 p.m. on Monday, April 20th, 2020. Thank you for joining us. I'm Janet Hill of the Rock Island County Health Department. Today we have Nita Ludwig, the Administrator of Rock Island County Health Department, Ed Rivers, Director of the Scott County Health Department, Tom Bowman, the CEO of Community Healthcare, and Becky White, the Regional Director of Child Care Resources and Referral. We ask that you direct your questions to the person you are addressing in the chat box, and the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. We do have some prepared statements we'd like to give you, and then after that we will do our usual Q&A. Nita, could you please start us off by reporting Rock Island County's numbers?
Sure. For today, the cutoff time is 2 o'clock. For today's numbers, we have 6 new reported cases for a total of 268 cases reported in Rock Island County. Unfortunately, today we do have another death to report. This was a 70-year-old female who had been hospitalized, and that does bring our total deaths to 5. We certainly, our thoughts and prayers are certainly with this woman and her family at this difficult time.
In Scott County, our Department of Public Health has posted 172 cases. That's an increase of 17 since our Friday report.
Okay, now we'll go back to Nita for her opening information. Nita?
For many of us, the biggest change in COVID-19 guidance for our communities has been the proclamation by both the states of Illinois and Iowa to close in-person educational instruction for our K-12 schools for the end of the year. This guidance tells us that we are entering a phase of a temporary new normal, at least for the moment. We all must continue to do our part by social distancing, staying home as much as possible, keeping at least 6 feet between you and anyone else. Wash your hands frequently with soap and water for at least 20 seconds each time, and using hand sanitizer when washing your hands is impossible. Covering coughs and sneezes with a tissue or into your elbow. Wearing a face covering when you must go out for essential supplies, and staying home when you're ill. This COVID-19 situation isn't going to resolve itself quickly, and we will continue to look at decisions that will best protect our communities. That being said, future decisions won't be easy. They will likely be hard. That's because there are some knowns and many unknowns when it comes to COVID-19.
Okay, so what do we know about COVID-19? We know that it continues to spread in our community and will continue to spread in the upcoming days and weeks. Even when we reach and pass our peak, that doesn't mean that the number of cases will go down to 0. It also continues to infect people of all ages. We've talked some about how the different age groups have been affected. Keeping ourselves spread out and away from each other is what will make us successful at combating this pandemic. So what don't we know? We don't know when our peak or high point for the number of cases is going to happen. The best we have right now are forecasts created by public health models, and similar to weather forecasts, they can be inaccurate. But at least we're using the information available to better prepare ourselves for what is ahead. It's also unknown for how long we'll have to social distance and stay home. That isn't an easy answer or a comfortable answer, but it's a realistic answer. The good thing is public health and our healthcare partners are here to help provide these recommendations to you and your family. It's vital for you all to listen to the guidance and follow it for yourself, your family, and your community. We also don't know what our long-term normal will look like. And we understand this can be the hardest thing to deal with at this point. But there's a very important known for our community. We know that our community is strong and resilient, and we will push forward.
Thank you, Ed and Nita, for those opening remarks. We will now hear from Tom Bowman with Community Healthcare. Go ahead, Tom.
Good afternoon. I appreciate the opportunity to kind of update everybody on what we've been doing here at CHC. Just so everybody knows, CHC is a federally qualified health center serving the Quad Cities, Clinton, and Muscatine areas, serving almost a little over 41,000 patients annually. And so from the start of this pandemic, we had two goals. Our first goal was to protect our staff and patients, reduce exposure risks as much as possible, and limit face-to-face interactions, which we knew would keep our staff and patients safe, but also extend the life of the limited personal protective equipment supply that we had. The second goal was to maintain access to care for our patients. We have so many patients that have ongoing routine medical needs, whether that's chronic disease or other, that need to be addressed and could not wait a significantly long period of time for care. And so how do we do that in an effective way so that we maintain access as well as treat those that are sick or suffering from COVID-like symptoms? And so we initially started on March 16th setting up tents and ramping up a curbside care program where patients who had respiratory illness could come into any of our 4 locations within the Quad Cities and drive up and be tested and actually see a provider. So it was a little different than a drive-through testing where they would come in and actually see a provider and be evaluated on whether or not they needed testing. And that has gone very well. That got us through initially and allowed us to separate the sick patients from the well patients. Shortly into that, though, we started to see that there was a community spread here in the Quad Cities. Although that seems like a long time ago, early on, we knew that there was community spread here in the Quad Cities. And so we felt like it was no longer, you couldn't see the enemy, so to speak. And so patients that were asymptomatic could have been coming in contact inside our buildings. And so we had to move quickly to ramp up a telehealth options for our patients. And we have successfully done that, where we have moved 80 to 90% of our visits now start with a telehealth visit. And if they need additional care, we are still utilizing the curbside program for screenings or collection of tests, but we're also now using the curbside care for routine care for patients. So if a patient is a diabetic or something that needs additional testing or vitals to be done, they will start with a telehealth visit with their primary care provider. And if further analysis or physical exam is needed, they will be referred to our curbside care program for that service. So currently our curbside care can do physical exams, labs, immunizations, vitals, all of the things that you might do inside can now be done outside in open air. To do this, we've had one team that's been established. They are the only ones that come in contact with patients. We don't have any patients coming into our clinic with the exception of a few OB services at our Edgerton and our Moline locations. And so this really reduces the amount of patient-to-patient or patient-to-staff contact and reduces risk and exposure for our staff and allows us to further extend the life of our needed personal protective equipment. Early on in March 19th, we also moved quickly to shut down our dental office. We run dental offices in Davenport, Rock Island, and Clinton. And so we did shut those down except for emergency care. And even now we are utilizing telehealth to do screenings of anybody that might need emergency care to really figure out if they are emergent or if they could wait until it's safe to bring them back into the clinic. And so we're doing, 15 to 20 of those teledentistry visits per day now as well. Other outreach efforts, we continue to work on that with homeless populations and others within the community to make sure anybody that needs care can access care with us. We are running about 70 to 100 patients a day through our curbside care teams. Roughly 350 to 400 patients are being seen daily throughout CHC, whether that is telehealth or in person through the curbside care. We have noticed that the number of tests that we're collecting has continued to rise, people meeting the criteria to be tested, and so we continue to offer those. And then we have seen a greater percentage of those being tested coming back as positive than we were early on. And so we do have some concerns about that, but we do have capacity to serve this community. We feel like we're taking pressure off of the emergency departments and the hospitals by being able to effectively manage people through telehealth and/or through our curbside care programs. So it's been very successful, and we continue to look for other ways that we can serve our community. And we couldn't do that without our partners at Scott County and Rock Island County Health Departments. The two hospital systems have been integral to our efforts as well, and very collaborative in addressing the needs of the community, and also funders, whether it's the RDA, the Community Foundation, Disaster Recovery Fund, the Moline Foundation, and lots of volunteers who have dropped off masks and other supplies as we have needed them. So it's been really a community effort, and we are here for both established patients and new patients, and we'll continue to do that throughout this pandemic.
Thank you very much, Tom. Next, we will hear from Becky White with Child Care Resource and Referral through Community Action of Eastern Iowa. Go ahead, Becky.
Hello, my name is Becky, and I'm the Regional Director of Child Care Resource and Referral of Southeast Iowa. We support child care programs and providers in 19 counties, including Scott County. So during COVID-19, we have worked closely with the Department of Human Services to provide consultation and technical assistance to child care center directors and registered child development home providers. It is recognized that child care programs are a necessity for the essential workforce to continue their employment and support our communities. In Iowa, child care programs are encouraged to stay open if they can safely do so, but have taken several measures to ensure the health and safety of their children and staff in their program. The guidance given to them from the Iowa Department of Human Services, which is the regulatory body of child care programs, is based on the most current recommendations of the CDC and the Iowa Department of Public Health. These current recommendations include that they complete a health screening of children as they enter the program, which also includes taking the temperature of the child. Most programs are greeting families at the door for drop-off and pickup to minimize the number of parents and other family members entering the facility. And then throughout the day, it is recommended that children and classroom staff are divided into groups of 10 or less, and that they remain with that same group as much as possible and minimize crossing those groups during transitions. And of course, increasing the amount of hand washing and cleaning in the center has also been vital. As with many professions, COVID-19 has led to many changes and stressors for the childcare providers across Iowa. Many of them are small businesses that depend on consistent attendance and enrollment of children to manage their financial obligations, such as staff salary, rent, and supplies. With many families working from home or being unemployed, as well as the reduced class sizes of 10 or less, many of the programs we work with are stressed about the longevity of their programs. Iowa Child Care Resource and Referral, along with the various community partners such as Early Childhood Iowa, have been working to connect programs with information and resources available to them to help with these additional financial stressors. Our child care consultants work with individual programs daily to answer all types of questions, direct them to additional resources, and provide guidance. Additionally, Child Care Resource and Referral and the Department of Human Services have delivered cleaning supplies and paper products to programs that have requested items in efforts to show our support. It is also important to mention that Child Care Resource and Referral of Southeast Iowa provides parent referral services to the entire state. Parents, especially essential workers, are encouraged to call our parent referral phone number at 855-244-5301 or check out our website to receive a list of possible child care providers to meet their needs. This is a service that we provide year-round, not just due to COVID-19, where our parent referral specialists ask for some basic information from the parent, such as hours of care needed, the location of their home and work, and ages of the children. They then complete an individualized search to provide a list of possible child care programs that the parent can contact to select child care. To the committed child care providers within our community, we owe them a big thanks for continuing to be the workforce behind the workforce and providing care to our children. Additional information about child care guidance and support can also be found on our statewide CCR&R webpage at www.iowaccrnr.org. Thank you.
Thank you, Becky. Again, thanks to both of you for being on and providing information and for all of your support during this COVID-19 response. It's, through partners that so much of this is taking place. We are now going to go to the questions. We did have one question submitted ahead of time, which we encourage you, if you have a question that you think we would be best served by being able to see it and get some information that might not be otherwise in front of us, we encourage you to submit those ahead of time as well. So we'll go to that question, and this will be for Nita. Rock Island County is now reporting about 100 more cases than Scott County. What do you attribute this to? Could it be testing procedures or testing availability?
Sure. So we know there is a lag in reporting of cases at the state level. At Rock Island County Health Department, we're counting cases that are reported to us by the labs doing the testing. We are seeing about a 2 to 3 day delay in those numbers being added to our county's totals on the Illinois Department of Public Health website. Ed has spoken of a similar delay for the Iowa Department of Public Health too. The difference between Scott County's numbers and Rock Island County's numbers could also be partially due to the social determinants of health and our demographics in Rock Island County. For more than 15 years, we've seen poorer health outcomes in our community health assessment for Rock Island County than we do see in Scott County. The data are showing that patients who have comorbidities have a greater chance of serious COVID-19 infection or dying from the disease.
Thank you, Nita. We do have a couple of questions here that will be for you, Tom. The first question, are the FQHCs, the federally qualified health centers, playing any role in the effort to expand testing? Do you want to touch on that as well?
Sure. Both in Iowa and Illinois, the federally qualified health centers in both states have almost every center is doing some form of testing, whether that is through certain clinics that they operate, or some have stood up drive-through testing or drive-up testing in various parts of the state. Locally, we've been testing, as I mentioned, from starting on the 17th of March with our outdoor curbside care. And so we started very early compared to a lot of our sister organizations in both states. And so we felt like we got out in front of it pretty quickly. Originally, we started with just established patients of CHC, but we quickly, within a couple days, opened that up for new patients as well. And so in Illinois specifically, Governor Pritzker announced last week a partnership through the Illinois Primary Healthcare Association, which we're a member representing the health centers in the state to provide additional tests, which we received on Friday and actually about 3:30 in the morning on Saturday. We received about 300 additional test kits. So we will put those into circulation and start utilizing those through our curbside care program. So that does expand our capacity to do testing, although I would say that LabCorp has also been, they are a reference lab and they have been able to supply us with the needed testing up to this point. So we feel like we will be able to continue to expand testing, but we do want to make sure that it's following guidelines for who qualifies for a test. It's not just open to anybody to drive up and want to test. It still needs, we are still asking most of the patients to call, have a visit with our provider, verify whether or not they need a test and meet the criteria, and then we will perform that through our curbside care.
Thank you, Tom. I think that got at two of the questions, so that's good there. We do have another question. How does CHC find homeless patients or vice versa who need testing? And how many homeless people are taking advantage of CHC's COVID-19 testing?
Yeah, so the second part, I don't have specific numbers on how many homeless. I know that I've talked to my staff, so anecdotally, we have maybe a couple a day that show up or that call and they are with a partner organization and they are directed down here to get that done. So if a patient walks up to our curbside program, we've actually set that up so that we can do a telehealth visit. We have outdoor equipment, a tablet and or a phone where they can connect with one of our primary care providers to get an assessment done prior to that. And then the curbside care team will go ahead and do the test if it is indicated. How we find homeless patients, CHC for quite a number of years has operated what's called a healthcare for the homeless. It's part of our base federal grant, and it's specific to provide primary care to the homeless population in the Quad Cities. And so we have an extensive network of partner organizations, whether that's the shelters, Salvation Army, the food bank and others who are also serving homeless populations. And so We know that, and we've reached out to those organizations to let them know how those patients can access our care. So it's really kind of through a referral or a direction from our partner organizations, or many of these patients have been established with us for a number of years, and so they are our patients and they come to us when they need the care.
I'm going to skip ahead to one other question that goes back to the testing, and perhaps you can respond to this, if not one of public health can. But is this still testing with swabs and not serology, correct, Tom?
Yeah, with our testing, it's all nasopharyngeal or nose swabs. So that's how we're collecting at this point.
And I believe that would be the same for any of the other providers in the community at this point. We'll now direct the next question to Becky, and this is childcare related. What is the demand for childcare in the Quad Cities area? Has it increased or decreased during the pandemic? And who is calling with the need for childcare?
So I would say childcare has, we've seen a consistent demand for childcare. We've geared up a couple times with anticipation that we would be overwhelmed with requests, but it's been maintaining pretty consistently. We had concerns about childcare prior to the COVID outbreak, partly because of the significant decrease of childcare over the past 5 years in Iowa. So we already had some concerns, and we're seeing demands for childcare both from families as well as employers. But we have not seen a big increase since the pandemic had started. As far as calling for need of childcare, a lot of the calls that we receive are essential workers, but there's also families that are calling that are planning ahead for childcare, that maybe have lost their current childcare, or they're looking for different childcare, or their childcare program has closed. So we're starting to see that across our region, as well as childcare programs are choosing to close due to financial reasons and don't anticipate being able to reopen. So we do have some parents calling with concerns about looking ahead of what childcare they will be needed. I do also want to commend the currently open programs in our community for stepping up when they were able to take additional children. I think that's one of the reasons that we're not seeing an increased demand or an increased number of parent referral calls. A lot of the programs accepted essential workers, children of essential workers when needed, and opened up additional school age programs with the closing of schools. So I think that also helped fill that need within the community.
I think we had a question that followed up just to what you said. Is there a need for childcare for school-age children? So it sounds like some of that has been remedied.
Yeah, the Scott County Family Y is one that stands out to me, that really did open up some additional childcare programs, or some of their non-school day programs, and try to accommodate any needs for families in that regard.
Thank you. Again, thank you to both of you for being on and to provide this good information for our community. Thank you everyone for joining with us, and we look forward to talking with you again this week. Have a good day, everybody.
Thank you.